Good noon to everybody. Today is Monday, the 8th of February 2021, and this is the English language summary of the daily press briefing here at the CCSA. So first of all, thank you to Dr. Bird or Dr. Apisamai for the Thai language edition, the presentation just now. Actually, this week is very important in terms of a number of occasions, events, celebrations, as well as deadlines as well. Start off first with Chinese New Year. As I mentioned in the last briefings, this week in Thailand we will be celebrating Chinese New Year. And just to caution everybody in your families, when you meet with senior citizens, your grandparents, your parents, of course it has to be done in a very precautionary way, because Chinese New Year actually entails families and extended families meeting each other, dining with each other, talking to each other, going out to buy food for the celebration, as well as giving out money to the younger children as part of the tradition. But of course, all of these would be possible to be done online and with the strictest measure possible. A second occasion, of course, this coming Sunday actually is Valentine's Day. So Valentine's Day is actually celebrated the world over, and in Thailand as well. So I guess for Valentine's, what I have to say is that we would like to advise for people to be very careful in terms of the contact. I think we might have a slide coming up there in Thai language. The trend, of course, for Valentine's these days in Thailand is COVID-era Valentine's. So I guess I just have to summarize that perhaps if you meet your loved ones or go on dates, just exercise the utmost precaution. Sort of like if you love me today, you'd be careful and you'd be cautious and take care of both of our healths in that sense. Or if you love me today, let's stay together and be together forever tomorrow in the future. So therefore today, let's be healthy. So today, let's take care of each other and try to take in all the necessary precautions, DMHTT, during Valentine's Day. Another deadline, on a more serious note, is on the 14th of February. That would be the deadline for the registration of foreign migrant workers that we had announced earlier. And after that deadline, penalties will apply for employers who do not register their employees. The assistant spokesperson, Dr. Bird, also mentioned about the precautions in terms of shared facilities, in terms of talking and meeting with each other. So basically, sharing the same facilities, meaning living in the same dormitories, living in the same apartments, that would not pose a risk per se, staying and using the same public building or public area in a condominium, for example, that would not pose as a high risk per se. But talking to people without masks for 5 minutes, for example, that is indeed a risk. Or being in an enclosed area or room with other people without any ventilation for 15 minutes, that would be a risk as well as sharing utensils, as we had mentioned in the earlier briefings. So moving on to the general situation, the number of cases that we have for today. New confirmed case, we have 186 cases, of which 35 cases are from active case finding. Total new recoveries is 468. So new recoveries is higher than the confirmed case for today. 468 recoveries, 186 confirmed cases. And no new fatalities to report. The active cases still under treatment, now has been decreased to a point. It's now 6,068, as you can see on screen. These active cases, there are around 3,000 of these active cases, 3,000 out of the 6,000 that are of patients in field hospitals. So just some observations from the presentation of Dr. Bird just now, in that in Samut Sakhon, in general, the number of cases are reducing continuously. In Bangkok, there are a number of cases. The contact tracing investigation of cases are still ongoing. There is a particular case that Dr. Apisamai mentioned just now about a vendor who traveled between provinces, so that will be investigated further. In terms of the active case finding, right now, as informed earlier, we are reducing a little bit the intensity, the frequency of the active case finding because we have been able to identify a large majority of the positive cases in Samut Sakhon in particular already. So what remains now, we have around 5,000 active case finding missions instead of targeting 10,000 people, targeting 5,000 instead of 10,000 people. So that would be in 50 factories, for example, with factories with rates of less than 10% of infection. That would be the target and that would be reduced in terms of the adjusting of the mission as we had informed earlier. Anyways, active case finding will still continue in Samut Sakhon and as well as in other areas, such as in 6 districts of Bangkok, like Pasir Charoen district, and the districts of Bang Khae, Nong Kham, Bang Bon, Jong Thom, and Bang Khun Tien. Also, just to mention that we're asking the juristic offices, juristic persons of apartments and condominiums in Thailand to please be very, very mindful and very, very strict in terms of the DMHTT measures, because certain cases have come to light from residences in condominiums and apartments around the country. So for other issues, I'll just add one short issue today, which is on the application of the Rao Chana scheme by those without smartphones. So the Finance Ministry had answered some online inquiries regarding application of Rao Chana scheme for people without smartphones and announced that those people can apply for the scheme by visiting the nearest bank, the Krung Thai Bank branches from the 15th of February 2021 onwards. The Finance Ministry will also announce the means of using the schemes without smartphones in due course. So just a heads up on that scheme that we had detailed earlier. So just in closing, just remember that as things are gradually returning to normalcy, we still have to be cautious, definitely. As I mentioned, condominiums, apartments, and various other areas, business establishments. It's imperative that we always practice DMHTT. It includes social distancing, wearing masks, washing hands frequently and thoroughly, and checking your body temperature. And last but not least, the applications that we have been talking about time and time again. So this is all I have for today. The afternoon of most days during this week and the past weeks and the weeks ahead, we'll be having programs, as you know, but it's in Thai language, and from time to time we'll be summarizing those programs in English for the English language audience here. Like today, I believe we have a program at 2 p.m. as well on the COVID situation in different dimensions. So thank you very much for your attention today. It's Monday today. Have a very productive and safe and healthy week ahead. Thank you. สวัสดีครับ
ครับขอบพระคุณนะครับ